Everybody. So it's an exciting session. We don't have a lot of time, but whenever there is a new technology that comes to the market, there is a lot of excitement, and of course we are excited about it. And some of you did ask about designer babies, and I'd love to talk about that. How the world is dealing with it, how we should be dealing with it. So I don't think we have time to go about the science because all the speakers elegantly described, and Dr. Rao talked about the policies for the first time, and I'm very glad that proactively that we are talking about the policies. It's just a fancy name. Gene editing did exist for the last 15 years. The excitement recently about gene editing is about the simplicity of technology. So those of you who know the existing of zinc finger proteins, and in fact there are companies in the Bay Area, particularly I can name one which was very active called Sangamo Biosciences. And I knew of the leader who unfortunately died, Alan Wolf, was one of the first companies to do zinc finger trials in the US. So editing the gene or the genome is not a new thing. It's been there for a long time. The reason we're excited about it is it has actually been made extremely simple. And the reason it has been made very simple is by using technology like CRISPR and Cas. So right now there are companies based out of Boston called AdGene. You might have heard about it. You can actually order the plasmids of your interest. In 1 week it will come to India and you can do a gene editing technology today. So there is nothing new. So don't worry about this sexiness of technology that exists today. The new thing is the ease of the technique. Now, one thing that we haven't talked about, and I'll probably spend just a minute talking about the legal issues that is looming large. And there's a huge patent battle which is playing out in the US, particularly between Broad Institute in MIT Harvard and Cal, which is the University of California at Berkeley, because the inventors of this technology, the two ladies, one is Emmanuelle Carpentier, who is actually right now in Germany, and she was in France, Belgium before, and Jennifer Doudna, who is in Berkeley, on one side, and Feng Zhang, the Chinese American researcher working in MIT Broad. And they're fighting for a simple thing, which is very interesting because I think as Indians is an interesting story. It has socio-cultural obligations because we need to understand how this whole issue of IP rights play out. So I'm not going to take sides that who is right, who is not, because it's a legal issue, it's not a scientific issue. Because publication is a scientific issue, this is in the court right now. But the fight is basically whether the CRISPR-Cas system was invented in eukaryotic system, which is primarily for human, by the Berkeley team or by the Boston team. Now, of course, the Boston team claims that they are the first one to show it in human cells, and the Berkeley team claims that what they did show it in prokaryotic system, the bacterial system, was very easy to copy in a human cells, and it was just a matter of time. In fact, in legal terms, that they say anybody who is skilled in the art should be able to do that. Now, we'll leave it to the court how the court decides, but whatever the court decides, it has huge financial and economic effects because the companies or the institution that will hold the patent will be able to license it out. So one thing, how we will do things in India would obviously depends on if I haven't gone through the patent applications, but if it is a PCT application with India as one of the countries, anyone who is thinking about using this for commercial purposes will be affected. Now the second thing, Dr. Rao talked about the policies, and of course China, like any other technology now, is taking a leading role. You know, they're the first one to do gene editing in human non-viable embryos last year. It's very important term, non-viable, because you don't have permission to do in human viable embryos. But earlier this year, the Crick Institute in the UK got a permission to do gene editing using CRISPR in viable human embryos. However, they must destroy the embryo in day 7. So the research has to be done particularly in manipulating a gene called OCT4, which is involved in the early embryogenesis, but destroy the embryo in day 7. Now, I think both Srinivasulu and Dr. Rao talked about doing T-cell therapy. This is one of the extremely exciting for me who studies cancer, that how it is important, because a lot of people right now do sequencing of cancer. So we understand what are the different mutations, what are the different genetic changes represented by a cancer. And if we can isolate the T cells which are specific for the immunogens which are in that cancer. Now there was some thought about in the solid cancer which are not like melanoma, because melanoma the mutational burden is very, very high. But in many solid cancers the mutational burdens are not high. So is it possible to actually isolate antigen reactive, and these are neo-antigen reactive. So these are the newer antigens which has mutations, reactive T cells. And in fact, Steve Rosenberg in NCI recently had a paper in New England Journal who suggested that KRAS, which is one of the oncogene, has a mutation at location 12. So KRAS was considered to be a non-targetable protein. It was impossible to target KRAS. And he has shown recently in colorectal cancer, you can actually derive neoantigen specific T cells specific to KRAS and put it back into the patient and get the cancer out. So from the legal, policy, and in science, we have a lot to learn in India. I think the point to learn in India and do it, we are not a country who do things right fast. So we must not copy what the China does doing it fast. I think what we should do it, rather do it well. It doesn't matter whether we are not fast. But if we do it well, I think at the end of the day, we'll win. And that is what we need to stick to it. Thank you.